Hello and welcome to Talking Live. I'm Dr. Robi Ludwig right here in Starshop Studio in Times Square. And we are talking about one of my favorite topics, beauty and how to get beautiful. And in order to help us out, we have a national award-winning plastic surgeon, Dr. Konstantin. He is on the Upper East Side. I'm going to call him Dr. K because that's what his lovely staff calls him. And it's easier to say, quite frankly. He's going to go over some of the things that can help us be more beautiful just in time for summer. And also, if you like and share the show, you will be eligible for $2,000 worth of complimentary treatments that Dr. K will provide in his gorgeous, beautiful doctor's office on the Upper East Side. So without further ado, Dr. K, thank you so much for joining us. And I have had the pleasure of working with you as well. You are an artist. And one of the things that I loved, and you probably don't remember this, the first time we met was at a mutual friends party. You were hosting an art gallery, right? And it was a fabulous event. And we were talking about what you did. And you just had such passion when you talk about making faces beautiful. So this is obviously just a life mission for you.
Thank you, Robi. Yes, thank you for your kind words.
True words.
Thank you for inviting me today.
Yes.
Yes, absolutely. So I'm very passionate about my work.
Yeah.
And of course, all the women are beautiful. And I'm really privileged to contribute just a little bit to that beauty.
And just on a personal note, one of the things I really like about your work is that it doesn't look fake or faux, because sometimes people are afraid to go to a plastic surgeon because they fear that the lips will be too big or that they'll start to get that alien look where, you know that look.
Oh, absolutely.
It's that look where nobody wants that look, and it can frighten people, but you really have a different approach, and you actually gave us some 5 steps that can help us be beautiful. And we are going to start with the Botox.
Okay, so I'm going to start revealing some of my secrets.
Yes, please do.
Botox really should be your secret treatment.
Mm-hmm.
Nobody should ever know that you had Botox done. Mm-hmm. And of course, we don't do those frozen faces like we used to do some years ago. Remember when people really couldn't move a single muscle?
Yeah,
Botox?
I know some people really like that.
Some people did, but that is so out of date.
It's out of date.
Absolutely. This is so old-fashioned.
So that's interesting. There are trends in plastic surgery. How do you stay on top of the trends?
Well, you just have to be mindful of all the recent developments.
Yeah.
And, of course, going to the conferences and really talking to people and see what people like.
Mm-hmm.
And a lot of things we do. When we start doing them, we're going a little bit to an extreme, like Botox or
mm-hmm.
lip enhancement or cheek enhancement. When doctors just start doing things, they get very excited, they get a little carried away, but then with time, everything sells, and people really want to look natural.
Yeah.
And they want to look like they had nothing done.
Right. And what's nice about Botox, at least this is what one doctor told me, even if you just try it once, it's helpful.
Absolutely.
Anything you can do to just stop the muscles from being overused, correct?
Right. That's correct. And we don't want to remove all the muscle activity, right? Mm-hmm. So we want people to be able to express their emotions. We want them to be able to look surprised or excited. But at the same time, we don't want those muscles to create those deep wrinkles that's going to stay with you for the rest of your life.
And it also requires knowledge of the face, because this is one thing I'm very particular about when people ask me who to use. And I say, listen, plastic surgeons really know the face. They know the muscles, they know the face, and you have to be very careful who you go to. You don't want to just go to anyone or do this on the cheap, because you can have an eyelid fall, and even though it's temporary, I've been there, you don't want to be in that position.
I would have to agree with you.
Yeah.
Botox is a very safe treatment. So if you get Botox that's not very good, it's almost like getting a bad haircut.
Yeah.
You can get over it, but it's certainly going to be very unpleasant.
And how much, for people out there who are just curious, how much does Botox cost? How much should people plan to pay for it?
Depends, of course, on how much Botox they need. It
Okay.
can start somewhere around $300 or $400 and
Okay.
go up to $1,000.
So do we go over all the things that Botox does?
Well, it's the most important thing. Botox gets rid of the wrinkles. Right?
Yeah.
So, and this is something that's.
And this is from your office, correct?
This is from my office, of course, and you can see how the person who could lift their brows and create all those wrinkles, the brows are in the same position, but all the wrinkles smooth out. So Botox helps to eliminate that excessive muscle activity and just gives your skin a chance to regenerate and get rid of all those deep lines.
I love it. I love it. And look at her forehead. That's amazing. She just, when you see those smooth, a smooth forehead, you think youth. So that is one of the ways, one of the secrets behind staying beautiful. The next is cheek enhancement. So I have to say, this is something that's a little bit new for me, and I don't know that people out there necessarily think about cheeks. I mean, you do, obviously, but there's something you say that restoring the cheeks really helps in terms of helping the face look more youthful?
Absolutely. And the cheeks is usually the first area where we notice a little bit of aging, right? Even with very young people. We can see the cheeks begin to sag a little bit. There is a little hollow that develops under the eyes. And the face still looks young, but it just looks tired.
Yeah.
So building up the cheeks, restoring that volume, restoring that beautiful contour will go a long way towards making somebody look more energetic and more useful.
Now, is that done with a filler?
That's done with a filler.
Okay.
And there's a number of fillers that we use. And the greatest thing about that the fillers are very long lasting.
Oh, okay.
They last for about a year and a half, up to 2 years. And after that time, a little correction or a little enhancement can be done to maintain the positive effect.
Now, what about recovery time? Is there bruising with that? Can you go right to work after having it done?
That's another secret that I'm going to share with you.
Okay.
There's virtually no bruising.
No bruising.
Cheek enhancement.
A
lot of times people come in for a lunchtime enhancement. They have about an hour.
That's the way to do lunch, people.
Yes. They come
I'd rather see you than eat. I would.
They get cheek injections and they go back to work, and absolutely there's no traces of injection left other than beautiful cheeks.
Do we have a picture of the cheek enhancement?
So this one is a little more advanced.
Okay.
You can see how the shadows for the patient on the right create a little bit of an aging effect. And just softening up those shadows and smoothing out the cheek contour has a very nice rejuvenating effect.
Why do we lose fat in our face? And why do we gain fat in other places?
Yes, absolutely.
Why?
This is the process that we all go through. We're all in the same boat on this one. We lose the fat in the faces, especially people who exercise. And this is the worst thing of all. People who are athletic, people who exercise, people who live healthy, they lose fat in their faces, and of course that's make them look older. So we have a beautiful procedure called fat grafting, pioneered here in New York by Dr. Sidney Coleman, who recently retired, unfortunately. We take the fat from other places in the body where we've
got
really
plenty of
don't
fat in
need
other
it
places.
and can spare
Right. I've got
And
a lot. In case anyone needs extra, call me.
Thank you. We have a fat donor.
Yeah, fat donor. I knew I was worth something.
So we take the fat, we prepare it a special way, and we put it back in the face in the area that lost volume.
Okay.
And that looks the most natural.
Is that instead of a filler?
It could be done instead of a filler. It could be done with the fillers. So depending on the location, depending on what, there's a lot of little technical details.
And that's why we need you.
Absolutely.
Because that's where your just knowledge comes in.
And this is the longest lasting filler. Your own body fat can
Your
last
own body
for
fat.
10, 15
Oh
years,
yeah, or a
even
lifetime.
longer.
Mine's very stubborn. It likes hanging around. Okay, all right. Okay, this is a big one. I've discussed this with you. Under eye treatment. This is a big one for many ladies. This is a big one for me when I look in the mirror, the dark circles under the eyes and the shadows that can happen. Very frustrating because it's not something that is easy to cover up with makeup.
Yes, absolutely. And this is something that we can use filler to improve. Now, dark circles is one of the hardest things to treat.
Okay.
And they go away with fillers sometimes they don't. But even worse than dark circles, people have a lot of hollowness and irregularities under the eyes. And even younger patients have that. Somebody in their 20s and 30s can have the eyes that just make them look tired all the time.
Right.
So using the filler to smooth out the contour under the eyes will really make a huge difference.
So does that cause bruising?
Unfortunately, yes.
Okay, so
under the eyes is not a lunchtime procedure. It's the skin under the eyes is very delicate, so it can bruise a lot, and of course there can be a little bit of swelling there, so one have to be mindful of that.
So one of the things you also mentioned is skin moisturizer for under the eye, and I just want to mention that our sponsor for the show is Immunocologie, and they work very closely with many doctors because it has clay in the product that has a rejuvenating effect. So before we leave, we'll definitely show a picture of Immunocologie, and we'll have a link too where people can buy the product because it's also fantastic. And moisturizing is a great way to prevent the skin from aging, right? You want to rehydrate the skin.
That helps to smooth out the wrinkles.
Okay.
And it's the best prevention. Right?
Okay.
So if you are not ready for Botox yet, and people ask sometimes, right? I'm not ready for Botox, I'm not ready for fillers. What can I do to prevent the wrinkles? Moisturizing.
Moisturizing is the key.
Best answer. Absolutely.
And also a good moisturizer. You want to use a company that has good, solid products in it because it does make a difference in obviously sunscreen. So we have a picture here. Can you do this to me? Next time I told Dr. K, he's going to just do something to me on the air. I don't care. Put me out to sleep. I don't care if it bruises. We're going to do something on the air. So you can see that it's not painful. I think sometimes people are afraid of needles, and that's what stops them. And if they know that it's really not painful, and if you go to the right person, you feel great. You actually feel great doing something to make yourself look more youthful and feel better. But here we have one of your clients again. And what did you do here?
So we used the filler under the eyes.
And I didn't think her eyes were that bad. Okay.
This is obviously a young person. She's under 30, but just that tired look and
trust me.
A little bit of a dark circle.
Yeah.
A little bit of the irregularities. And
you should see my dark circles.
Smoothing it all out. Really makes it
so what did you use for her?
So the filler is called Bellaterra.
Okay.
And it's one of those new fillers that we use in the areas with a very delicate skin.
Okay.
We can't use the older fillers in the area because it would show through the skin. So this one was specifically developed.
And how long does this last?
This lasts for about a year and a half to 2 years.
Okay.
In most patients, of course, everybody's a little different.
Everyone's a little different. And what's the recovery time as far as bruising?
Recovery, if one gets a bruise, it takes about a week or two to get rid of.
Okay.
Right? So again, depending on the person, but using a little bit of makeup, of course, helps to
recover. Or a lot of makeup. Whatever, a lot of makeup, right. Thank God for makeup. Number 4, beauty treatment, lip enhancement.
Yes.
So that's something that I think people are a little bit scared of. I have to say, someone that works at your office who's gorgeous already was thrilled with the lip enhancements that you gave her. In fact, she showed me the before and after pictures. She was beautiful both ways, but I would have never known.
Absolutely.
I would have never known unless she was so excited to tell me. So how do you do a lip enhancement that doesn't make you look like you have duck lips? I don't like that look.
Well, you're absolutely right. People are very scared. Every time I mention lip enhancement to one of my patients, they say, oh, no. I don't want to get those huge lips.
Yeah.
But we don't have to go to extremes, right?
Yeah.
So we do want to keep the lips looking natural. We want to preserve the natural shape of the lips. But of course, like everything else in the face, the lips start losing volume.
Right.
So after
Of course.
about 30 or 40 years old people, the lips just becoming smaller and smaller, and we have to bring them back where they should be. We don't want to give somebody a huge lips. And this is something that came from the celebrity culture, from photo models who need to look good on a picture.
And we had a long
Yes.
discussion about this in your office about the women who are models and want the big lips because of the lighting or whatever it is that they're doing.
Done photography of somebody with artificially enhanced lips can look very beautiful.
Yeah.
Right? But in real life, for people like you and I,
Right.
we're going to look at
real
this and
people.
say, yes, absolutely. We're going to say, oh my God, your lips are so
You
done.
don't want your nickname to be Lips.
No.
You just do not. So is it hard to figure out how to do just a little amount? Or that's, again, where your training comes in and it's not difficult?
It's not hard to figure it out.
Uh-huh.
And most people who do lip enhancement,
and here we have
this lips were done. Right?
Yes.
So you can see how the shapes is beautifully preserved and the size is perfect for her face. And there's really nothing artificial about it.
Nothing at all. You would never, ever, ever know.
So most people that you see who had their lips done, when it's done correctly, you just can't tell.
And so I think that's the really interesting point to underscore, is that when you have work that's done well, you just look better. You don't look fake. And I think that's really important for people to know. And isn't it great that people can call you, Dr. K, and know that they can go to you and have natural work done by a board-certified plastic surgeon that's been in the field and honored in the field? It's just very comforting, because not everybody has a go-to person, or a lot of people are secretive. They don't want to share a secret about who their plastic surgeon is. Okay, so skin resurfacing is our final beauty secret. What exactly is that?
So the skin, we can get a beautiful facial contour. We can get beautiful cheeks, beautiful lips. We can use Botox, but we have to take care of the skin.
Yeah.
Right? Because when the skin becomes dull, when people get those fine wrinkles, when it just loses its youthful, that kind of a youthful quality, right? You just see the age there. So we have to take care of it, and there's multiple ways we can do it. Now, of course, we should start with a good moisturizer.
Right.
That's something that,
and also I'll just mention that we will mention Immunocologie and get a picture up and a link up so people can find that as a choice out there.
Absolutely.
Where do we have it? There we go. Okay.
Yes, and I hate to make people spend a lot of money, but really you have to get a good moisturizer that contains all the ingredients to support and nourish and keep your skin looking good.
Yes.
So this is a great start. Now, once that becomes ineffective, right, you always have to go to the next step.
The next step.
So the next step,
I feel like that's my nickname. Next step. The next step. What's the next step? Okay.
So in this situation, we can use either laser or one of those new treatments that became very fashionable, like platelet-rich plasma.
Okay, I want to talk about this.
Yes.
I want to talk about this. What exactly is that? How does it work? I think I'm all about it. I've never tried it. I'm really open to it.
Yes, absolutely.
Okay,
so
what would that do for me?
We would take your blood.
Take my blood.
And we isolate the fraction that contains a lot of biostimulating factors and all those things that make your cells, the cells of your skin will start dividing and laying out collagen and promoting that whole process. Right?
Okay.
So once we isolate that fraction of your blood, we use a special microneedling machine that helps us to create small channels in your skin.
Okay.
And we apply that platelet-rich plasma fraction to your skin in order to get absorbed.
Okay.
Right? So the effects of it is really rejuvenated look. The skin just becomes a little plumper. It gets that nice shine. It's getting that youthful look that you really.
How long does it take?
It's just gets younger.
Yeah. And how long would that take?
So the whole treatment takes about an hour. And by the next day, your skin might be a little red.
Okay.
Right? And after about 2 or 3 days, that redness goes away.
Yeah. And you're good to go?
And you're good to go.
Wow. Well, I'm interested in that. I love that idea.
People love doing it on Friday because by Monday they can
Right.
go to work. And
Okay. Okay. That's why it's good you have office hours on Friday too, which is really good. Do we have a picture of the skin resurfacing that you've done?
Skin resurfacing.
Okay.
So this is one of the treatments that we did, and this was done with a laser.
Yeah.
And of course, if you can see, we got rid of those dyschromias and everything looks smoother.
Yeah.
And of course, we did a facelift there as well.
And did a facelift. All right.
For good facial contour.
And basically, people look like a younger version of themselves.
Absolutely.
Kind of a younger, prettier version.
Yes.
Well, when we told our audience that you were coming on the show, there were a lot of questions. So we created just for you, Dr. K, an Ask the Doctor segment.
Wonderful.
And so here were some of the questions that people wanted to know. How do I make my eyes look younger?
Okay, very good. So the best thing to do, getting enough sleep.
Enough sleep.
Absolutely. This is something that everybody should do.
Yeah.
So second would be using a good serum or a good moisturizing cream specifically developed for the eyes. Right? So those two things will go a long way to making the eyes look younger.
How about foods? Can foods make you look younger?
Eating healthy is very important.
Okay.
There is no, or at least I believe, there's no specific foods that can make you look younger.
Yeah.
But cutting out the junk food and excessive alcohol and things like that will go a long way towards making you feel better.
So healthy living.
Absolutely. Make you feel and look younger.
So here's another question from our viewer. If I had to choose one treatment to help me stay beautiful and youthful, what would you recommend?
That would be a facelift.
A facelift?
That absolutely would be a facelift. Everybody should get one at least once in their lifetime.
All right, when do we start getting a facelift? I thought you'd say something simple like Botox.
No. So facelift, on average, rejuvenates the face by about 15 years.
Okay.
And often I feel like I'm giving a person those 15 years of their life back.
Yeah.
This is such an amazing procedure that makes people look and feel younger. And it lasts for a very long time. So if they have to be only one treatment, I would definitely.
Facelift at what point though?
Yes. Everybody's a little different.
Okay.
So people start considering getting a facelift nowadays at about mid-30s, maybe.
Mid-30s?
Mid to end 30s, yes.
Wow.
Yes. Facelifts are getting younger and younger.
What do you think about that? Is that too young?
It's not
No?
too young because people notice a lot of changes, and we are so perceptive nowadays.
Yeah.
With all these selfie cultures and everybody's taking our pictures.
Yeah.
Right? So people are looking at their photos and they say, "Oh my God, I never realized I have those jumps and my cheeks are sagging." Right? So people are bothered by that.
Yeah.
So, absolutely. This is
All right.
something that we
All
can
right.
do for them.
Who am I to argue? I mean, this is your field. Okay. How can I avoid getting treatments that look unnatural or that make me look like everybody else?
You would have to be very selective. You have to find a doctor, and it's so easy to find a plastic surgeon nowadays, right? You don't have to go to multiple offices. You don't have to schedule multiple appointments. Just go on the internet.
Yeah.
Look at everybody's before and after pictures.
And
this is the best way to find a doctor. If you love those before and after pictures, this would be the right doctor for you.
And also make sure that they are board certified.
Absolutely.
And that they're affiliated with a hospital, and that you have an interview first to make sure you feel comfortable with the person that you're working with. Because I think it's about the relationship as well and feeling that the doctor hears what you're looking for. I mean, as a therapist, that's what I would recommend.
I can't agree.
Right. Okay. And the last question is, what kind of supplement should I put on my skin, if anything? Because there's retinol and there's vitamin C.
Retinol is probably the most effective rejuvenating treatments. And I will share, since we are sharing secrets here, I will share a secret. I'm going to go on a retinol regimen right after we're done here.
Oh.
I wanted to go yesterday, but I realized that my face can look a lot.
All right, so
better,
this will be a before,
yes,
and then you'll come
this
back
is what you see now
in
is
June,
before.
and we'll
Yes,
see the after.
absolutely.
Right.
So I am going on retinol regimen.
Okay.
Also, things like hyaluronic acid or any facial cream or product that's hyaluronic acid based will be very helpful in keeping the skin nicely hydrated.
Terrific.
Peptides are very effective as well. So, but retinol is by far the most effective.
Well, terrific. Thank you so much for joining us and helping us figure out how to stay beautiful and to be our most youthful self. It can never, you can never find out this information too soon or have it talked about enough, because we all want to know how to look our very best. So at the end of the show, we will definitely have a link up so you can find Dr. K and some of his recommendations. And also we have Immunocologie. We're going to have that link up as well so you can find out more about a really excellent line that's sound and has really fabulous ingredients. And here's to you being beautiful all the time. Don't forget to like and share the show, to be eligible to be chosen for complimentary treatment worth $2,000 by Dr. K. He is kind enough to offer that to our audience. So we hope you will certainly do that and be in the running to be your most beautiful self. And we will see you next week. Thanks for joining Talking Live.